she's definitely, she keeps being my cheerleader because she reminds me that there's so many folks out there lost who don't have to be lost. You don't have, like, this space, public health, is so broad, is so dense, is so wide. But if you just first see all your options and then are honest with yourself about what do I want given those options, then it becomes a lot easier. I think a lot of us flounder in, like, what is this? And so after quickly working with my clients, I just get them up to speed. These are options. This is what you're looking at. This is the reality. You're running into walls here. Stop doing that. Let's start doing this. And quickly they gain that traction that my first client did. Like, she's like, oh my God, it worked. She's like, I got through. She applied my methods in 3 months, and she's like, I got a job. And everyone around her was shocked.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 79. Hi everyone, Omari Richens here. Thank you all so much for joining me. Be sure to follow me on Instagram at the PH Millennial. Be sure to subscribe to this channel, to leave a like, to share with a friend, to leave a review. It greatly helps this show get out to more people and help people navigate their public health careers. I really enjoyed today's story, and I think I enjoyed it even more just because if you're watching this on YouTube, you'll get to see some glimpses of a supermom doing supermom things, and she's doing great things in both like her day job as well as the business that she started, as well as raising this wonderful young man that she has here. And you're definitely going to hear a lot of Gio during this interview, but pay attention to all the great insights that she shares, because I think that her information is valuable. And if you haven't followed her on Instagram as yet, I'll definitely do that. But without further ado, enjoy today's episode. Peace. Today, we have a public health professional with 15 years of experience in program management, strategic planning, change management, policy initiatives, and implementing interventions for high-risk populations. She got a bachelor's degree in psychology from the University of California, Los Angeles. She worked for a few years before she got her Master of Public Health degree from the University of California, Davis. She currently works as a senior consultant in strategic planning, community health at a large healthcare system. She is also the CEO of Public Health Hired, where she mentors public health professionals to land their dream job. Check her out on Instagram at Public Health Hired. We have Zoila Reyna, MPH. Welcome to the show.
Hi Omari. Hi everyone.
Hi, I'm glad to have you on. I'm very excited for this, actually.
Yeah, I'm very excited as well. I mentioned I'm a big fan.
You did. Well, how are you doing, and how have you been coping during the pandemic?
Oh my gosh. Like everyone else, just, trying to stay positive and follow guidelines. And, I actually got hooked to news, to be honest, over the pandemic. I just was inhaling news 24/7, and I'm not doing it anymore like that as much. But that's definitely something that got me through. And obviously my son, I have a 3-year-old, his name's Giovanni, and I don't know what this pandemic would be like, so isolated otherwise. I'm so blessed that, we have each other. So he's definitely been a shining light.
Okay, that's also, I'm glad that you all both have each other. And I believe that you have a Spanish background, I should say a Hispanic background.
Sí, soy Latina. Soy Latina, yeah.
If you'd like to introduce yourself in Spanish, you're welcome to do that.
Mi nombre es Zoila Reyna, hablo español. He ido a las escuelas para psicología y para salud pública. Tengo mi maestría en salud pública y ahorita trabajo con una organización de salud en Sur California, y estoy muy feliz por estar aquí.
Muchas gracias. Spanish is coming. It's taken a lot more like I feel like I just have too many things going on to try to do. But I really, really want to do it. And I think it's going to be on my list of things to really dive into in 2022. So I look forward to having more conversations in Spanish.
Oh, great. Yeah.
Yeah.
I encourage it. Qué bien.
Awesome, awesome, awesome. So tell me, how do you identify, and then tell us a little bit about your personal background?
Yeah, so I'm Latina, Mexican American. I grew up in the Central Valley with my parents and five siblings. So there's six of us, and there's six within 10 years age range. So we were all very, very close. But we can't come from humble beginnings. My dad worked in the fields over the summer a lot, did odd jobs, and my mom also did odd jobs, including like just helping with even loan processing at one point, as well as selling furniture, as well as selling cheese. So that's something that I helped with her for like 12 years. She did that to help sustain us. So in the Central Valley, we come from a very small town known as Traver, California, very proud. But it's like a town of 1,000 people. It's very tiny. It's very rural, no sidewalks. We walked to school every day, holding hands, making sure we were all safe. Um, but you know, my mom's still there actually, so definitely still have my roots there. Um, and over the years, my siblings have kind of moved on, and we've all graduated from different universities. And like you mentioned, I went to UCLA, and then I went to UC Davis, so I've moved around a lot in California. In fact, I've moved around like Omari. A unique fact of mine is I've moved every year,
Wow.
every year, and I'm like, maybe there's something there I need to work through. But that's another episode. That's another episode. But you know, my son just turned 3, and we live in his fourth residence.
Wow.
And this home is so meaningful to me here in Glendora. I really don't take it for granted. This is going to be where I know I can be for a while. I've needed that kind of mental space. I've needed that kind of calm. I've worked my butt off. You know, that's part of the moving is like I work, and I'm finally at a space and an organization and at a unique place with the pandemic. A lot of us work from home now at my company. So it's been a unique sort of blessing and combination of circumstances that I think I needed in order to just kind of feel like where I am now, to be able to speak with all of you, my colleagues, around how to help you all get hired in such a unique time of our lives.
Yeah, and I would say that you took the all that moving that you did in your life, and now you're helping people move into better roles in your job, in your I guess
Absolutely.
in your company, I should say, not your job. Well, I guess
Yes, yes, at
it's
my company, yeah.
one of the same, right? So before we jump into your story, I actually want to ask, what is change management? What is that?
Oh, great question. So, change management is a key term. It's a key term that I try. There's a lot of key terms out there in public health, and it makes up the uniqueness of of our world, of our field. Change management simply is what it sounds like, which is you manage the change within operations, within implementation, within a new process. You know, for example, there's certain reports or regulation that certain companies have to abide by, whether it's taxes, whether it's federal funding, whatever that cycle is due. Sometimes organizations want to do it differently, or they want to do external consultants to do the work that used to be in-house. So change management has to do more with that space you find yourself in, which is how do you make adults make change at their job because they're so used to doing it a certain way.
Okay,
That's
awesome.
change management.
Awesome. Thank you for sharing that, because it's not something that I hear often. So I when I was reading your intro, I was like, oh, I'm definitely gonna ask that. So I fit that in. Okay, tick. So what
Yeah.
does public health mean to you?
Oh my gosh, you know, that is such a good question. So I feel like as I get older, to me, currently, public health means healthy, safe social norms, including, given everything that we know now with our environment, the social norm of healthy conversations, you know, healthy, open, critical thinking involved, you know, sort of just a higher level of who we should be as a society. But to me, public health and touches just the social norms of everything, whether it's at your job, whether it's at the city level, like what should we expect from city and sanitation and, you know, regulations and redlining. And, you know, there's so much to unpack when it comes to public health that it touches our lives in every way. But it comes down to, what should we expect from our governments, our society, our companies, and just individuals?
Yeah, I definitely believe that there's so much in there, and I love how you like start off with healthy, safe social norms, because I think it goes back to like lifestyle. If we can get people living and just doing healthy lifestyle and having healthy workplaces and healthy places for them to play and healthy conversations and connections and all these things, then it just makes all the other health related things just become part of life, you know. So you're just having health promotion built into everything that you're doing.
Exactly. I think my son just woke up behind
Yeah,
me.
he absolutely did. I tried to wave, but I don't think he saw me.
I saw you waving. You might fall asleep on the couch. You'll be okay.
That's absolutely fine. So you got your bachelor's degree in psychology at the University of California, Los Angeles. Tell me
Correct.
about, what was that thought process like going into that?
Going to UCLA was definitely a major milestone in my life. Looking back, I knew I worked my entire youth for that, because it was a very competitive space. Um, and I mean, our incoming average GPA for everyone, the average for my cohort was 4.1, and that was my GPA, at school, was a 4.1. And so I know that I had to push myself hard, just not only at school, but also outside of school. Luckily, because I come from that sort of, my parents just working hard and just, you know, having really good work ethic, having that sort of instilled in me and having to work hard, I think it lended itself well to just working hard in the academics, but also working hard, like volunteering a lot. And I ended up working a lot of part-time jobs. My first job, which is not listed on LinkedIn, this is probably the only job not listed, I was scorekeeper for a gun club at Kingsburg Gun Club. So at the summer, I would keep score of these 5 individuals who would stand in front of me and shoot these clay discs, and I would push the button for them when they wanted to shoot. And that was like my first job was scorekeeping for. I'm just like, what random job is this? Like, at the time it was so normal. Are you okay, Papas? At the time it was so normal, but when I say it out loud, I'm like, oh. So I've had odd jobs, Omari. Maybe that's maybe that's why I've been successful in public health. I've just been open to a lot. I'm like, bring it.
Yeah, and it sounds like you've been part of the community, you've been doing all these community things, being in a small community of 1,000 people, that in itself, I would guess that they're just close community ties and community bonds, because I know my dad, who's from Tobago, which is the smaller of the two islands, Trinidad and Tobago, in his days at least, less so now, just everyone knew everyone, and there's just a lot of social ties that were just naturally there, that that I didn't experience to the same extent that he did. But I know like smaller rural communities, they definitely have these because everyone's going to the same places, everyone's going to the same schools. So you're just continually interacting with people and things like that.
It's a very small world. Yes, it's in a good way. Yes, absolutely. But I also think that's was part of a driver for me to get out and to explore something else, which is, I'm very, I don't take for granted that I, got to be accepted to a school and also leveraged a lot of just at the time there was financial aid that I had available. I was eligible for a lot of grants. I know I have a lot of your followers are wanting to ask me questions about just education and loans. I'm also open to those conversations. It's not something that is highlighted on my board because I'm all about getting helping people get jobs and internships. But when it comes to even just what about the finances behind all this? Like how much did it, I'm open to those questions. Rarely do I get them, but I want folks to know that, we should have those conversations of grants and scholarships and, things like that. So I definitely worked hard for that, but I want others to know it's available to them too.
Yeah, absolutely.
Hi, Papas, you want to come and sit with me? You want to come say hi to Omari? He's like, who did he just hid from you? He's like, who?
I saw him hiding.
He might just be poking his head until I want him to come over. Come over here, Gio. But go on.
yeah. I think that's awesome. And if you want to have like a follow-up where we have like a session just around that, then maybe we like ask people questions and then some kind of thing around loans and grants and everything like that, because I think it'll definitely be useful for people. So I am down for that. I'll put it on my notes and we'll follow back up to do something like that to help more public health people.
Yes.
So did you go into school as a psychology major?
You mean like, did I choose it when I first started?
Correct.
I was pre-med, and I don't know if that was a degree I had. I forget if that was an actual degree. I think you have to eventually choose a degree, but take like these pre-med courses. So I think psychology was just kind of one of those routes you could take that also met the pre-med requirements. And I ended up going at UCLA. I did 4 years, including 3 summers. So I didn't stop. So I did summer session. And I also leveraged studying abroad, which I highly, highly recommend. Folks need to leverage that opportunity when they are at college, because there is nothing like traveling as a student. Nothing will replace that. Even when you think you're going to be older and travel, like, oh, I'll just do it for like, when I get married or a honeymoon, or when I want to go and celebrate, some birthday of mine, I'll go. But there's nothing like having access to just programs, just not just hostels, but just it's a different environment. It's a different welcoming that you receive in these countries because you're a student. So yeah,
absolutely.
Work it. Yeah, work it when you're in school.
Absolutely. Do you want to talk a little bit about your study abroad experience and what you
took
away from it? Yeah,
I went to Italy and Siena. I studied there for 3 months. It was like a quarter system, 10 weeks, but stayed a little longer, and then ended up meeting my best friend there in class, and her name's Terra. Shout out to Terra. But she's my best friend, and we've been friends ever since. And in Italy, I got to really live with a family, which is why I tell folks to take advantage of these opportunities as a student, because you can't live with the family, the way they, I mean, now even with COVID, even worse, right? Like now you can't, but I guess, before all this is what I'm just letting folks know is, getting to live with family and seeing they didn't speak English. So I had to learn Italian under the roof with them. Lots of awkward moments. I still don't remember how to say toilet paper, but she's like, you have to say it. And I'm like, but you know what I need. I don't. Anyways, so it was a really great experience. I even had another girl who stayed in the same house. So it was 2 of us. And we got to just watch their habits and their sort of lifestyle. You know, I admired seeing how she, the lady of the house, really focused around food and very like every day everything was fresh. And she asked me every morning what I wanted for dinner. And it was never pre-planned the night before. It was just like, what are we doing today? It's just very organic. And I appreciated that. One of my favorite memories is watching Afari Toy. Still remember the show Afari Toy? It is it's like a, it's just a show, kind of like The Price is Right, or you
Like
know,
a
just
game
a
show.
game show,
Yeah.
Family Feud kind of feel. So Afari Toy was the bomb, and so I remember watching it with this lady at night, and she was like, "What are you doing here? Go out!" And I'm like, "No, this show is fun." So I have a lot of those pleasant memories, and then traveling with my colleagues or my friends to Venice and Pisa, and I got to go to Athens at one point, and hear, you know, just people's life stories from different countries. That's also such a beautiful part, is people are so open to you being a student. I remember sitting at a cafe, and like this gentleman wanted to just lecture us about Greece. We're like, okay,
Free
you know, he
tour.
wanted, yeah, free tour. So anyways, a lot of great memories studying abroad. Yeah. Say hi.
Hola, Gio.
Say hi.
Well, thank you for sharing that. I think that in itself is like a public health experience, because a lot of the times we have to deal with communities where we're learning new cultures and we're trying to embed ourselves to understand where people are coming from and their norms and their cultural different ideas and things like that. And like one thing, like the toilet paper incident, it just like that in itself reminded me of, well, not really related, but I was at a like a conference, a panel talk, and it was in Spanish. And this was my first like Spanish panel talk, and I had to listen to interpreters, and it was just a completely different experience. And it makes me appreciate what Spanish speakers have to deal with just to like hear regular information. And that in itself, I think, is a great lesson for all of us, to just have empathy for others and take our time in leading their cultures and be respectful as best we can. And yeah, so
No, that's a good point. Yeah, I don't think I've ever even connected that. No wonder I was so open to just living in someone's house. I'm like, how do you live? Like, what, you know, I was so curious. Yeah.
yeah,
Yeah,
I
that's a good
definitely,
point.
and I definitely think like summer study abroad, or like study abroad in general, definitely do it, especially if you've never traveled before. It's a perfect opportunity to travel while also getting education, while also meeting people and seeing cool places. So definitely do that.
Oh yeah. Yeah. It's definitely worth the time. Um, very unique
Absolutely.
time in your life.
Okay. So did you have any other takeaways from your bachelor's degree?
The best sort of thing that came out of my bachelor's degree was the network of women that I made. To this day, my background at UCLA allowed me to meet, you know, friends who currently are doctors, who are leaders in tech companies, who are pioneers in their own space. And I feel like that I am so blessed with. Like, I don't have that kind of, it's not so hard to make friends now. Well, maybe it's not so hard, but you know what I mean? Like, we don't see each other the way that we used to. And so I think for me, it's more of the network of women who I walked away with, who are in my life. Like, these women are still in my life, and they've been such great supporters of me and just my own choices. And they show up in times of need. And in fact, one of them, I told her I wanted to visit her at Huntington, Hermosa Beach. She lives she lives like basically an hour from where I am. And her idea was instead to take him, my son and I, to an alpaca farm. And she's like, "Oh, pay! I want to show him like alpacas." And I
Mhm.
thought that was so lovely. And you know, so that's the kind of relationships that I still have are from UCLA.
Okay, that is awesome. Geo is
Yes, Papas, you want to
getting
go to
full
an alpaca
attention.
farm? He's like, "What's alpaca?" I'm like, I don't know either. That's why we're going.
Absolutely. Learning experiences are all over the place, right? But
Exactly.
that is awesome that you're able to network and have those amazing relationships that really helped you out in life to this day. So that is great
Yeah.
to hear. So then you graduated from your bachelor's degree, and your first job was as a tobacco program coordinator at American Lung Association. And I was listening to Dr. Huntley's podcast before to try to get some undercover questions to ask, but I didn't get to finish it, unfortunately. But I heard this story at least, and I thought it was very, very fascinating. So I would love for you to share how you came across this.
How I came across um, this unique opportunity. First of all, I ended up moving from Los Angeles to then go to Sacramento. So after I graduated, I went to Sacramento, and I didn't have a job, but I was living with my brother on his couch. And I ended up working quickly part time as a not barista, but as a cashier at Naked Coffee House, which is the best coffee in Sacramento. Shout out to Chris, owner of Naked Coffee House, but it's the best coffee. And uh, anyways, while I was there, I ended up just hustling to look for a full time job. I was like, I had never been paid salary. I was like, I know I can get paid salary. Like, what is that world about? What is this benefits world about? I was so curious. But at the time, I was like, I know I can just get a job, right? So I ended up working as a cashier. Anyways, so I ended up applying to a few places, tried to be a subcontractor at some mental health organization for something. And, I had gone to a couple interviews, and then this one came up on Craigslist. And so your question is like, why are you on Craigslist looking for jobs? So honestly, I found the nonprofit section of the cities to be really the best place to find just nonprofits posting. Why? Because I somehow just knew that it was the cheapest way for them to post, and it was the least maintenance. For what I mean by that is, like, for LinkedIn, you need to actually like maintain your presence a little bit, or post, or do the likes, or you kind of become an entity on LinkedIn. Or on Indeed, maybe you have to pay more or whatever. But with Craigslist, it just is cost effective, to be honest. And you just have to be very careful and stick to reading very carefully what these jobs are asking of you. But when I saw this one under the nonprofit section, it's for the American Lung Association. So it's not the first time that they post on there. They use it often. A lot of nonprofits do. So people shouldn't be surprised if they find it. But what was unique about this role is that it talked about recruiting youth for tobacco enforcement and working with the FDA, the Federal Drug Administration. And I'm like, what? Like, what is this? And so it was more of the curiosity of like, is this real? Like, what are you asking of me? And what is this all build up to? Like, why? And but I remember the recruiter, the manager at the time, wanted to know, like, what's your experience in sales? Like, sales? Well, I actually used to sell Herbalife. That's another random fact in my background. I used to be a part of that marketing program. Herbalife. Shout out to Herbalife and
Shout out to
Herbalife
Herbalife.
users. A lot you don't know, Amari. A lot you don't know. So yes, I sold Herbalife, got my sister involved as well, and was a part of that for a while. But they were more focused on like, have you done sales and gotten people to take action? Like, give us examples of that. And they tried to give me more credit than I felt like I was due. Like, I kind of felt them digging into like, tell us more about the Herbalife, tell us more about like your sales, tell us more how you got people to do these things. And I did my best, answering what I thought they wanted to hear about, like, I know I can do this. They wanted someone who also spoke Spanish. So because I did, they trusted that I could speak with parents and convince basically parents to let their kids be these undercover agents for the STAKE Act. It stands for Stop Tobacco Access to Kids Enforcement. and the Stop Tobacco Access to Kids enforcement. And I see it every day at the grocery store. And I know you do too, Omari. It's basically that big red sticker that says, call this number if you see an illegal sale of tobacco. It's this big red sticker. So next time you go to a grocery store that's, or not a, like any store that sells tobacco product, it's on the counter. It's required. If you actually read it, it says Stop Tobacco Access to Kids Enforcement Act. So it is the Stake Act program that we were feeding into. So that sticker actually allowed me to educate the schools, the counselors. It was definitely one of the biggest marketing materials I had access to, because once I realized what this program was really trying to do, that's how I was able to actually get really good at recruiting. So I was like, oh, it all ties back to you going to the store. You see this all the time, you know, and so anyways, but getting the job in itself was an experience, because when they finally wanted to give me the job offer or have the final interview, they did ask me to set up a place to see them. They were like, well, we're coming from Fresno. You need to find a place in Sacramento to meet up. And I was just going to meet them at the coffee house. And my sister-in-law was like, no, you're crazy. This is an interview. You need to like get a real conference room. I'm like, where do I get a conference room? And so she pulled strings for me, and I got a conference room across from the Capitol, like literally across from the Capitol. We were looking at it in our meeting. They were like, you got the job. Like, what? They didn't really have any questions for me. I mean, they did have a couple, but they were like, and one of their questions was, do you have a vehicle? And I said yes, even though I didn't. And I like to highlight this. I've actually had to share this story with some of my clients, because they're like, oh, they're asking me if I, you know, if I do this, or if, you know, I guess that you need to live in a certain location, but I live a little further than that. And I'm like, well, just tell them that you already live there with a friend. Like, just tell them you have the car, even though you don't have the car. Because if you pay me, I can get a car. It's sort of the chicken and the egg, right? So those are kind of that's something that I remember saying. And my bosses laugh about it. They're like, you didn't have a car? I'm like, no, I didn't have a car.
But you got the job.
But I got the job because all I needed was a pay stub. So
well, that's absolutely an amazing story, and it's very, very fascinating that is on Craigslist, and the job in itself, recruiting youth to kind of like try to get sold tobacco products is another just funny thing. And I can even imagine the type of conversations you would have with parents around that.
Very interesting. Yes, I ran the gamut, and Omar, you probably can sense I've dealt with a lot of characters, and I feel like that job, I did it for almost 4 years, and I traveled all up and down California. I know the counties of California by alphabetical order, because I had to look at numbers every single day on like who's in Alpine, who's in Butte, how many in Calaveras, how many in Contra Costa. Like, I had to know just down the line. But also just working with these parents, both Spanish speaking and English speaking, some of them conservative, some of them liberal, some of them coming from just different countries. They're like, are you going to steal my child? Like, there were so many just concerns about their safety. One of the things I had to convince them on was basically letting them go in a van with 2 adults without the parents. And these adults were FDA agents. They were like state employed or federally funded, state employed. And I got to meet them. They trained me like early on in my career. They're like, this is who we are, this is what we do with the kids. So they showed me in an operation that these kids are basically picked up and taken far enough so that they're not in their own community. They don't want the kids to be recognized as someone who's like, yeah, he's been here, like, kids go to the same 7-Eleven or the same store, the same grocery store with their parents, so they don't want to take them to that one. So they would take them far away enough to be kind of not recognizable. And they would have a legit California ID card, which many of them I would help them get. To be a part of this program, you needed one. And so I would take them to the DMV. I've been to like half of the DMVs in California. just helping these kids get their identification card. And that was a big plus for parents. They're like, oh, you'll pay for this and you'll take him? I'm like, yeah, just so yeah, there was a lot of background administrative work I supported. That's why I was really critical to the operation. But there was the FDA agents that actually would pick them up at another time, schedule them, and then go and train them on how to ask for a certain cigarette. And it had to be protocol, obviously. The kids basically wear like a wire and are not shown in a video, but the adults are wearing the video camera basically. So the adults are always in the store, they're never left alone, the kids are not going to be in any danger because the adult will always be there. And then when the child tries to make a purchase and there is an actual sale, there's the receipt, there's the video, and so that's shown as evidence for the fine. And there's like tiers of fines, and they change over time. I don't know where they're at now, but it is one of the most successful ways that the state has been able to keep the sales of cigarettes down or tobacco down to children from that enforcement.
That is fascinating stuff, and that is awesome that you're able to do that work. And it is so interesting. That is not something that we think of usually, but people are doing this type of work. Like kids are out there trying to get owners to sell them tobacco so that they can get fined, so stores can get fined or shut down or whatever that case.
I mean, a lot of them would say no, though. Let's give the stores credit. They're doing what they, the rates are low because they know this program is out there. Actually, they know that they can get fined. So, and they're educated about it. They're like, this is the program. This is what happens. These are the fines. So it's really up to them to train their staff and kind of not do it. Like, don't sell to kids. You saw he was like the ID is legit. The ID will show the kid is not 18.
Yeah.
So that's part of the process. Yeah.
Okay. Awesome. Thank you for sharing that. And then after this job, you went on to get your Master of Public Health at University of California, Davis. But when did you know about public health? Because earlier on you said that you didn't know about public health in your undergrad. So when did that come up for you?
So great question. So part of the engagement that I conducted for this work I described with youth came from working with other tobacco control type projects. And I didn't really know what tobacco control and prevention really entailed. We were funded by the California Department of Public Health, Prop 99, and it's part of tobacco sales tax that goes back to prevention and funding. And so we basically were one of those projects getting these funds. And so it's a network that the California Department of Public Health basically maintains, that they want us to work together. So I ended up going to Alameda Department of Public Health, Butte County Department of Public Health, Del Norte Department of Public Health, Calaveras Department of Public Health, just all these departments of public health. And I'm like, what is public health? Like, because we were funded by the California Department of Public Health, it was just like, okay, now we're funded. Now we have to support all these counties and all these youth. Like I said, I had the counties on my wall seeing numbers. These were numbers of how many kids from that county. So my role was really aligning with tobacco control, tobacco prevention groups. And so not only did I work with the departments of public health and their coalitions, they all have coalitions they have to maintain. And a lot of them have youth coalitions or adult coalitions. It just depends on their funding and their resources. So I try to tap into those, but I also was really successful with schools and really making friends and making new partnerships with specific teachers and faculty and superintendents and anyone who would just basically care to let me in their classroom. I've definitely been shooed away. Just like any, salesperson has. You get told no and get off our property kind of thing. So, you just are like, okay, thanks. It's a legit program, but okay. So, but for the most part, there were a lot of cool teachers who loved this program because they heard my spiel, they heard the presentation, and they had kids from their past. Like I said, I had been doing that job for 4 years. And so a lot of those teachers knew past students who did the program. And they're like, yeah, it's a good program. So the reputation kind of built over time at some places. But all that to say, I traveled all over, and I was stuck in these spaces of other colleagues in health education, like prevention. And I'm like, what's public? Oh, you have your master's in public health. What's your master's in public health? Like, I got to that point of curiosity, and eventually I'm like, why don't I have my master? Oh, I can get my master's in public health. It definitely was a time that eventually just kind of clicked that this is a good avenue for me.
Okay, that's awesome. Well, we always love to hear that people have found public health and they're in public health. So I'm glad that you're able to find it through your job. And that's cool that you were able to go like a bunch of different health departments and get to see at least the words public health, because I know a lot of us do not see those words until very, very late into our lives, into our careers, a little bit too late, but that's neither here nor there.
Exactly, yeah.
Did you have a concentration going into UC Davis?
When I got into UC Davis, I think at the time they had a couple concentrations, but the general one was, I think, the one I just accepted. And I was really a fan that is like a 1-year program. It's an accelerated program. So that was really a big seller for me. Not that I didn't want to be in school, but I really didn't. I was like, I want my master's. I want my master's, but I don't want to do a 3-year program. Like, that just sounded so long to me at the time. And so anyone out there, weighing their options, please consider UC Davis. Another shout out, because they have a really great program that can get you basically in and out and to work like as soon as you want. Some folks obviously take 2 years doing their program because they have other things going on. There is some flexibility in that, but I have yet to hear another program that can help you get in and out so quickly that's accredited. So there were, and I definitely commend folks who work and go to school at the same time. It's a big factor of being successful in public health. If you really want to make a name for yourself and think of and really discover all your options and get out there, I would say definitely consider working or doing part-time work or seasonal work or evening stuff or volunteering, anything that's getting you out there to expose yourself to helping populations, seeing people's stories, seeing the tough times. And I know some folks get a little, it depends on your ability to take some of it. Like, yeah, like some of this isn't pleasant, it depends on who your population is and who you're working with. But you can also work in other spaces of supporting folks, whether it's that administration aspect, being there for them when, hey, we got to do. In fact, I talked to an intern who was supporting a food bank, and it's like, I had to do all the bagging. I'm like, oh, good, that's good. You can find your space, whatever it is. So I ended up working full time going through my master's. And because I was working from home back then, due to my travels, I was on the road 3 days a week and sometimes would work on the weekends because that's when parents wanted to talk to me. They're like, we can't talk, we're having dinner. I'm like, when can we talk? We really need Billy. So so I would work on the weekends if I had to. And so I had a lot of flexibility in that role, and due to the flexibility with the master's program, it worked out nicely, but it kept my costs down, going to school. Yes, I had loans, but all my money went back to school. Like, let's pay off this tuition. Like, I don't want to carry this forever. So that's why I applaud people who work and go to school. Keep it up. It'll pay off, I promise.
Yeah, there's definitely a lot of benefits to it if you're able to take on the extra challenges or that are there. But like as you said, like once the job that you have is like as flexible, I think that definitely makes it a lot easier, or a lot more manageable, I should say, not easier, but a lot more manageable. So
Yeah.
shout out to you for doing that, because I definitely know it's not easy at all.
I didn't have a life, but I have a life now.
You have to give up something sometimes for the future, right?
Yeah.
So it goes. So did you have any other? Well, was public health, was the MPH with it for you looking back? Because you're like, oh, I should get my MPH, and then now you got your MPH. Well, what was that feeling for you after that?
Oh my God, it was definitely worth it. I mean, I feel like just it answered so many questions. It opens up so many eyes. I think if it's the right field for you, you just want more of it. I felt like when it was over, I was like, I could do this. I could do more. I'm like, really? Let's do more of this. So I feel like the caliber of speakers that we got access to, because the Department of Public Health is so close to us, that also helped. Just the networking opportunities we had. I don't know if I shared this already, but I was recruited when I gave my practicum presentation by the California Department of Public Health. So it was a very serendipitous, amazing honor to be able to be recognized by my colleagues right away, because what happened was I had been doing my presentation, my practicum capstone, for Winters Healthcare Foundation. Shout out to you. Does great work in Yolo County for farm workers, and they needed an program evaluator, and so I did that as my practicum, and that was what I was doing my presentation on. But I happened to mention, oh, I also work at the American Lung Association working for this project, and so that perked up the ears of the folks in the audience who were from the California Department of Public Health, there for someone else. They were waiting for 2 other presentations from someone else that was their intern. And so I was approached by 2 folks saying afterwards, like, hey, if you want to apply to any positions coming up, they told me the name. It was a health program specialist. So if anyone's interested in working for the Department of Public Health up there, look for that title. That's what you're looking for. But they were like, let us know and we'll help you. Like, we'll help you. And so they did. They like showed me the paperwork, what I had to do. And that's honestly part of why I love now doing what I do with Public Health Hired, is I pass that forward. Like someone who can say, like, I've walked a couple people now this year through state applications, and they're like, oh, how did you know that? And I'm like, because I've done it and someone showed me, and I had others do it, other times after that. Like, that's just you give back. And so I'm happy to show folks the rope when it comes to those government applications. But yeah, I would say take those presentations seriously out there, guys. Yeah. Take those presentations seriously. You don't know who's watching and who would want to hire you. So
yeah, you never know who's in the room. You never know who's in the room. And as you said, like, you put your best foot forward, you share that you're doing all these other things. They're like, oh, she's doing all these things and this great presentation. That's awesome. That's awesome. Yeah, I haven't heard many people getting recruited like that, but that I like that story a lot. So you were also an outreach worker and program evaluator. Was that during your MPH?
Yeah, that's the practicum. So that's with Winters Healthcare, where I was an outreach worker. Basically, I helped with like blood pressure monitoring fairs, and we did different health screenings. We would invite different vendors to be at different like sites. There were migrant centers or housing centers even where they would live, and so we would bring information and vendors to them: dental, oral health, mental health, just different additional services they had access to. And they wanted an evaluator. Like, they basically wanted me to kind of give them some sense of what's happening, like what's the reach, who's coming, what's the conditions of those coming. Can you give us a pulse of just who these active, like who's the health of those who are partaking in our activities, what's their health? Because not everyone would partake, obviously. So we could only inform them so much on that. But they didn't have that. They hadn't had that for a while, and so they had asked me. And again, that was actually a colleague of mine let me take a step back. So my practicum project, that was my second one. My first one had failed. So I've also talked to people about like, oh my gosh, like I'm so nervous about landing the right practicum project, or oh my gosh, I'm so afraid I have to start over. I'm like, it's okay. And I've also warned a couple folks to not start too early, because that's what happened to me, where I didn't really know what criteria needed or requirements or what's a standard project, that I jumped the gun a little too soon. And I ended up leading myself down a bad path, and then having to say bye to this organization that clearly also knew I probably shouldn't be there. And it was just a bad combination of timing for them. And so I ended up having to start over, and I made an announcement in my class, and I said, hey, I need a practicum. They're like, we thought you already had one. I'm like, I did too. I thought I did. Like, and so later that day, a classmate who worked for Winter's Healthcare Foundation, she asked me, do you want to be an intern at my job? And I was like, oh, what's your job? And so that's how we kind of got into the project with the migrant farm workers. So it was a blessing in disguise. Anyways, just don't start too soon. Give yourself time to know what you're supposed to do.
Yeah. And like, to your point, you never know who's in the room, and then always put out your intentions or your wants into the room, because you never know who's willing to help you.
Exactly.
Two great takeaways. And you're also a youth advocate in Terra Nova counseling. Was this also
oh my God, there's so many jobs, Omari.
Yeah, we're trying to get through that, man.
Are you sure you want to do all these jobs?
you tell me which ones.
Terra Nova, I love Terra Nova. That was such an eye-opener. Okay, so what was I saying? Terra Nova.
Yes.
Terra Nova. So Terra Nova was, I was their youth advocate, and I was partnered up with the parent advocate, where between the two of us, we made sure that these families going to these counseling sessions for the youth had what they needed, whether it was just making sure they were able to get to their appointments, dealing with bus routes, for example, or additional tutoring and advocacy for tutoring. Some of them had really challenging mental health issues or going through difficult times. And so I was occasionally asked to be at ELP meetings, ELP, which were educational learning planning. There were individual plans for these students. They were mandated. They're like a state contract almost. Mm-hmm. So I would help represent, especially if the family was Spanish speaking, I would make sure that I was there to help translate some of that if needed. Mm-hmm. I also helped translate in some of the sessions with foster youth, just foster parents, giving the foster parents updates on just how the youth is doing outside of the counseling. Obviously there was a lot of confidentiality I wasn't privy to, and that wasn't the goal of these home visits, but sometimes it was like a grandma raising their grandchild, and the grandma needing to just run things by me about, like, can you help me find this? Like, he needs this kind of support at school. So that those are the kinds of support that I would give as a youth advocate for this counseling agency, and hear these parents out and these kids out.
Okay, that's great work. And when was that in your timeline again? Can you remind me?
So I ended up working. I had like a part-time job before I went to get my master's in public health. So I had the full-time job and then the part-time job, which was this peer advocate role. So it was part-time. Okay. And then I got to do the full-time. Yeah.
Okay. And then we're going to talk about the job that you got recruited into after you graduated your MPH. You were a health program specialist 1 at the California Department of Public Health. So we know how you got into that role. What did you do?
Yeah, so like I had shared, the health program specialist role, that actually came from the folks from the California Department of Public Health seeing my presentation, my practicum presentation, and inviting me to apply. So they were the ones who informed me that this health program specialist role was ideal for me, that you fit these qualifications. Given what we saw, given what we heard, you do meet this criteria. And so I had never applied to a state government role. In fact, because I lived in Sacramento, that was a goal of mine. When I moved there, I was like, well, if I'm going to work at the state, or if I'm going to live at the state capital, I want to work at the capital. Like, I want to try to work for the government if I can. And so that was a goal of mine. I just didn't know how that was going to come about. And yes, it had crossed my mind that, oh, maybe I should try to apply to roles at departments of public health, but I was also open to county jobs. Like, what if I worked for Alameda County or Contra Costa County? You know, there were so many counties I had already become familiar with at that point. So, but because there was someone who was from the inside, who was already in that role, he basically made sure I was filling out the forms correctly. I wouldn't say he like made edits for me, but he definitely reviewed what I was about to submit, and he would be like, yeah, okay, you know, maybe highlight this a little more. Like, he just kind of was very general in his feedback, but it was enough for me to kind of sense from him, like, you're fine, like, you know, you're good, just apply. And I think he had already put in a good word for me to the supervisors that I was worth interviewing. So I did have an interview with a couple supervisors after the application. By the way, from beginning to end, just so you know, that was an 8-month process. 8 months. You heard it right. 1, 2, 3, 4, 5, 6, 7, 8.
That's way too long.
8. So yes, it's out. And I knew, and it's not even that I knew I was gonna have it. It's just like, but I knew they wanted. I'm like, I knew they want. And throughout those 8 months, from applying, waiting to hear back from the screening. So because the screening happens at government, for folks who don't know this, state government, even local government, but federal, state are very harsh on this, where they have their HR technicians or analysts doing really critical screening and using a very templated screening approach. What I mean by that is they have their checklist. They're just like literally looking for things. And if you're not including those things in your resume or in your application, then you're scored lower. So the goal, you know, part of what I do with now my coaching is really ingraining that in people. Is like, you don't know who's screening you. You don't know what checklist they're using. But all I know is that to them, the job announcement is the most critical thing. And that's what I really learned from state government, is they're really good at that, at screening you. And so if you can pass their screening, then you can pass anyone's screening, basically. But yeah, I throughout those 8 months was still applying to other places because I wasn't getting hired. I mean, they kept interviewing me. They kept me in that my boss, basically the person who was going to be my boss, she would call me and say, hey, you know, we're just letting you know we're still interested. It's just the paperwork. It's the paperwork. Like, they kept saying it was the paperwork. And I believed her, but I also was like, how long is this going to take? Like, I mean, really? Like, what if then you tell me, like, you know what, the funding didn't come through? Like, they could have said that, you know, like, you know, we really had this position, but now the funding fell through. And so I always warn people, like, don't take the company's word too seriously until you see documentation of an offer. Like, show me the money.
Show me the benefits.
Yeah, show me the benefits from Jerry Maguire. Exactly. Show me what it's all about. Like, start date, you know, salary. And so it took a while, but from application to the start date was 8 months for that job. So yeah, the job, getting into that role, was definitely a journey, and I was losing my mind. Just the waiting game was horrible, but I kept busy at my current job that I had. So I had still been working at the American Lung Association, and I wasn't trying to let go of that until I found that next role. So that was part of the transition.
Yeah, that's very smart because I think a lot of people might think to quit their job before they get another job, or and as you said, like 8 months, that's almost a year of interviews. I know most jobs probably aren't going to be 8 months, but for example, my job that I'm in right now took about 5 months, which is half a year, and
That's
that's in,
also long.
yeah, that and I feel like that's more and more the reality of where we are because people want to make sure that they're picking the right candidate, that they're going to be a good fit, that they're going to be at the organization for a while, all these types of
Exactly.
things.
I always say companies take their time because if they choose the wrong candidate, it costs them money.
Yeah.
So
And
they're
they,
like, we rather get that right person who's going to make us more money and maximize our benefit, our profits, and make us look better.
yeah,
Like that's what we want. And so, yeah, I tell people keep pushing it until someone sees that you're going to add that kind of value to that
yeah,
company.
yeah, absolutely, absolutely. Awesome.
Yeah.
And then after your role as a health program specialist one, you moved on, I'm guessing, to become a bilingual research interviewer at Rand Corporation. So how do you come across that?
Oh my gosh, that is another famous Craigslist find. That is another the Rand Corporation was another Craigslist find. So I basically had been struggling with wanting to stay in Sacramento. It had nothing to do with the job. It had everything to do with just, do I see myself here? Is this really where I want to like have a home? Is this really where I want to like have my roots? And I didn't. Like I just didn't. And I tried, but I just couldn't see myself staying at that city any longer. And so I basically made the very difficult decision after already a year having tried to find another job in LA, just kind of applying and using a friend's or family's address as the address that I lived. Like I was doing anything to try to get interviews.
Mhm.
I did get some traction on a few jobs. I even got to a fourth interview where it was like an assignment. And so I knew I was very qualified for work, but I did nothing happened. And so finally I realized I don't think I can wait to stay there any much longer and wait until something maybe comes through. I'd rather just move back to Los Angeles and start from scratch. And luckily, at the time I was single, I didn't have a child, I, didn't have any major commitments. So it was an easy sell everything, get up and go. I just took me, my car, packed what I could in my car, and that was it. And I stayed with my friend in Hollywood. My friend, the friend who's going to take us to go see the alpacas, that's the same friend. She's been with me through everything, including this, where she offered her couch in Hollywood. And she's like, "You're smart. You're a hustler. You're gonna get back on your feet, and I would be happy to let you crash until you figure that out for yourself." So she's definitely been a blessing in my life. But yeah, I was able to hit the ground running when I moved to Los Angeles. It was Valentine's. Um, what year was it? Oh my God, I don't remember the year anymore. It's been so long, but I remember it was Valentine's weekend. So I remember it was memorable for me because it was like loving myself, feeling like doing this for me. So moving to Hollywood. We're moving to Hollywood. It was like my movie moment. And
Yeah.
so I immediately looked at the job boards, Indeed, LinkedIn, and my good old friend Craigslist. Looked at the nonprofit section, I think even the healthcare section to see what else was out there. And I found the Rand Corporation, which is a very well-known organization. I don't know if you know it, Omari, but they're huge think tank, been around for years, started with kind of being known in the press for the war, Vietnam War, but now they're more ingrained in public policy and really just influencing that literature and influencing that kind of work. And I didn't really know who they were until I stumbled upon them on Craigslist. And they were looking for a bilingual interview researcher to help with Venice Family Clinic opioid research. So it was very specific funding for an opioid research project and targeting, just folks who, whether it was heroin or pills or any other opioid, they wanted to talk to folks about their journey and try to get them off it if they wanted. So I would interview folks in English or Spanish. They required both. And so I was trained on both and walk them through these very difficult questions. I think that's part of the work that continues to remind me and humble me on how critical our work in public health is trying to get to these people who are really struggling in our society. And, you know, I will never forget, one of the cases was this girl who was currently pregnant and she had another baby in the room, and she was clearly an addict. And in the questions, it broke my heart, but she would try to justify her questions because she knew she was scoring really bad. And so she always would try to justify why and say like, but my baby didn't watch me, or, you know, he was in the other car, the car that's the non-drug car, like talking about her, you know, taking her opioid doses. So that those kind of engagements I will never forget, and I think continue to propel me to reach these folks who, like, we have so much work to do. This is like, this doesn't have to be how it is for folks. You can get help. You know, obviously you don't know people's stories and how they got there, but hopefully our society can meet them when they need us. Like, we can do better. And so I think I remember training some folks later on in that project, other folks who were like becoming interviewers. And I remember one of the girls asked, what's the hardest part of this job? Is, you know, and I said, you know, what's the hardest part, which I didn't expect, was declining, because of the way that they were screening. Everyone screened differently. There was 100 and something questions, but sometimes even though you wanted them to get the intervention, because they were too difficult of a case, they were too, like, we would never be able to find them, or they are, you know, so far gone in their addiction almost that, like, you can't even, they're not they can't even understand they're being interviewed. Like, they can't participate in this because they don't even know where they are. Mm-hmm. Those were the hardest cases to say no to, because I knew they had scored so bad that we had to basically tell them, you're not eligible. And I think that was the hardest, because that was just the nature of the research. So I don't know if that made sense.
Yeah, absolutely does. And that is a difficult place to be in, to have to have conversations and questions with these people, and realize just like we should be able to help everyone, but there's just a lot of barriers and challenges in there. And like, to that point, we need to continue to do our work to ensure that all those people, and especially the most vulnerable ones who have the worst situations, have the resources and tools and people and supports to really bring them up and support them and get them back to a good quality of life, you know.
Yeah, they deserve that. We all do. We all deserve a healthy lifestyle.
And then at the beginning, when you're saying you move into your friend's place, you're using her address to apply for jobs. Do you, like, with your clients now, how do you view like addresses, and then as well as, do you still use Craigslist, or advise people to use Craigslist to find jobs? Those are the questions.
Great question. So now I tell people, don't put your address. It's actually a no-no. I don't know why I was doing it before, but that was, I guess, the norm back then. But now it is not. It is dangerous to do that. So please take off your immediate address, but you can definitely put a city. City and state is fine. Phone number and email is all you really need, but city and state is enough. I actually do tell folks, if your background doesn't show on your resume that you were already working in that city, you have to come up with something to justify why did you list the city as the place that you reside. If it's clear that you were like in New York this whole time, why are you all of a sudden in Georgia without proof of being in Georgia? So it's something that everyone has to just come to terms with, like, how do I approach this? And for me, I think I was willing to just justify that I was already moving, or like, oh, my, you know, like, I'm going to tell my boss as soon as I get a job offer that I'm moving. Like for me, it was kind of already a done deal. But I realized when I moved to LA, it was much easier to stand by the fact that I'm here, I'm available, don't have a full-time job. It was just an easier sell.
Yeah.
Like I realized part of the reason I wasn't getting job offers is because I was already tied up to another one and from another city. So they're like, why would she want to move all the way over here? We're not even going to pay her relocation. Why would she do all that?
Yeah.
So I just had to take matters into my own hands, which is what I did. And I quit and I started all over from Rand Corporation to then program director.
Okay, that is awesome. That is awesome. And then we're going to get into that next role as community engagement director at the American Lung Association in California. So how do you come across that role?
Yeah, so that one I actually found on their website, and I had already been working for them. Like I mentioned, they were my employer right after UCLA. So when I was working for the Tobacco Under Youth program, the undercover tobacco program, that was part of the American Lung Association. So I had a relationship with this organization already, and I just assumed I can't go back. I just assumed once you leave, like they're not going to want you back. And I'm here to tell you that that's not true. So anyone who's afraid of quitting their employer and afraid, like, what if I want to work here again? You can. It's totally possible. But I was just hoping to, explore different organizations. I wasn't trying to go back to what I already knew. But when I looked at their website, because I had already been searching for a while, and I'm like, you know what? Let's see what they're up to. I found my job. I read it and I was like, this job is for me. Oh my God, this is creepy. So it was a director of programs, and it was overseeing, also community engagement director was what it was retitled as. But basically it was implementing programs that were respiratory health, and it was working across different cities and hospitals for asthma prevention. There's my son jumping like a monkey. For asthma prevention, COPD, also quitting smoking. So we had a very well-known quit smoking program called Freedom from Smoking, and I would have to help recruit participants who are healthcare professionals. So I got really familiar with working with healthcare professionals due to that job. Actually convincing them to pay for an event, to come and register for an event, to like recruit their colleagues. And how do you get folks to take that kind of action and then present? And then I had to like help recruit these speakers. So I would recruit speakers for these events and have committees. This is where I also learned about work groups and committees and agendas and having structure. I mean, not that the other previous jobs did. I mean, the California Department of Public Health has a lot of structure, but what I meant was I had to bring a lot of that structure by myself. It wasn't given to me, right? Like you're in certain companies and the culture provides that structure. Other places, like it's you and you got to manage to all this now. And so that was a really great experience. To do that for such great causes, for lung health, for helping people with their respiratory illnesses. So that was a really great role.
Okay, that it does sound like a great role, and I'm glad that you were able to get it, and it wasn't Craigslist this time. And
no, it was not.
I also like the notes that you said there about leaving your job and also being able to get back that job or get back a different role in the same organization. And I think it is very possible, especially if you were a valuable employee. They're definitely going to want you,
Exactly, right, Gio? He agrees. Are you trying to be a monkey? I think he's trying to be a monkey at this point.
He is absolutely.
Let me get him his pizza. It's cool. It's finally cooled down. Here, Gio.
All right, and then after this role as a community engagement director or director of programs, I think you also mentioned it as you either shifted or got promoted into the state director of health education. So tell me about that process and then what you did in it.
Oh my gosh. So yes, that was an incredible journey. It's something I didn't expect. And it was an honor to be promoted, but it definitely wasn't given. In other words, I had to earn it. So what had happened was the day that I started, serendipitously, another beautiful moment in my career, was that same day was the first day of a new CEO. So the new CEO was starting the same day that I was starting. And so she came by the LA office and it said like, welcome Zoila. And she's like, oh, are you the other new employee? So it was like immediate bond with the CEO. It was like,
Awesome.
yes, hi, you know. So it was just fun to like see from the beginning, like her and see her unfold her vision. And, you know, I had no sort of experience from the first person who had just left either. So I came with a clean slate. And so I think she also looked at me to kind of be a part on her side and be like, you know, like, do you follow? Like, are you seeing my vision? And so I got along with her in that way. And then she brought on a colleague of hers from a previous place. Actually, did they work? I don't know how they knew each other, but basically she ended up being the vice president. And this vice president really coached me in a lot of ways, but she gave me credit because later I found out that she kind of had her eye on me more so because I was the only one who welcomed her to learn about our programs. Like I didn't come to her with complaints when she started as a VP, which was maybe like a few months after the CEO and I started. I said, you know, hey, let me know if you need to learn about our programs. I don't know if anyone's given you the rundown. She's like, no one's actually offered. Do you want? I'm like, well, I would love to. So like, there was no place for me. No one had asked me to do that. I just felt like if she was going to be the vice president overseeing our programs and our fundraising, so it was this dual role, it wasn't fair that she only got to hear from the fundraising team. I was like, do you want to hear about our programs and what people want to learn about? She's like, yes. And so I gave her like a 30-minute sort of presentation in my office of like, this is what this is what we do, this is who the partners are, blah, 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 blah. And, you know, I think she said like that really put a good impression of me on her. Like Zoila's willing to like just be available. And that's the kind of team that she wanted to support. And so over the time she was there, she was responsible in kind of restructuring the departments. And there was a lot of movement and she opened up this role. And so she had interviewed a few of us. I competed with my colleagues who were there longer than me. And I can tell you they were not happy that I got the role, who was their fairly newest. So that was a difficult sort of situation. Let's just put it that way. But I also got to be a part of training new staff, bringing on new staff. I was part of interviews. I was part of hiring panels. Even, you know, before that role, I was part of hiring panels because folks knew that I had that content expertise for the organization. And they're like, Zoila would know if like this person can answer these kinds of questions or just content kind of questions. So that's why I'm also trying in my role with Public Health Hired, I'm comfortable sharing the other side of the hiring because I've been on it. Like I've been part of building teams, also letting teams go, also being part of reviews, performance reviews. And so, you know, that's part of understanding how to position yourself. Like then you kind of really know what hiring managers care about when you're on the other side. They're like, oh, that's what we care about. Okay. So yeah.
Yeah, that's very important insights there. Like I'm thinking back to my time when I was in Alaska as a community health fellow. They allowed me to
Alaska?
yeah, I was in Alaska.
Oh my God. How long were you there?
14 months.
Oh my, you're like 14 months, no more, no less. Like get it out.
I would have stayed longer, to be honest.
Wow. What did you
Sorry?
What did you do?
I really got brought in to do the community health needs assessment and focus on the photo voice component, which is really like trying to get community engagement from groups that they didn't really have engagement with. So in that work, I got to meet like with the Filipino community in Alaska, the Alaska Native community, a couple other like nonprofit organizations, some youth groups. And then I also did a lot of program evaluation type stuff, grant making, research and development around like homelessness,
Wow.
houselessness, EMS systems,
Wow,
There's probably
that's a
some more in
lot.
there. Yeah, it's probably some more in there that I'm forgetting. But yeah, they gave me a lot of good stuff to work on. That is for
That's
sure.
amazing.
Yeah.
Wow.
I kind of, oh yes, I was talking about they allowed me to like be on the interviewing panel for one of the jobs, and I think that in itself is such an invaluable experience because we usually typically don't get to see what's on the other side, what those conversations people are having, or what are those things that they're looking for and different things like that. So just getting to hear people interview and ask them questions and see how the team reacted to that, I think was an invaluable experience. And yeah,
It is.
you're bringing some great insights to everyone at Public Health Hired with those skill sets that you have there.
Yeah, and if you're out there and you get the opportunity to interview someone, like participate, be a part of that panel because it does open your eyes a lot.
Yeah,
Yeah.
yeah. And then I also wanted to touch on the point that you said that you went out of your way or kind of went out of your way to offer this help and support and showing them something about the organization. And that in itself is something that a lot of people are like, they know, I'm not going to ask them that. But just taking that small initiative had helped you so much in your career and just put you on a good standing from the start with that new VP.
Yeah, and I think there are folks who ask me. In fact, I do have a couple folks who just DM me questions like that, which I'm happy to answer. Like, what do I recommend if I'm trying to get my foot in the door, quote unquote? And there is something about the newness. So, like, I always say, try to be aware of any new opportunity on the horizon or anyone new coming in. And like, kind of to my, you can't control that obviously, but these are things to be aware of. Like, if you all of a sudden your manager leaves and now you have to report to someone else, like that's a newness. Like, welcome that. Like, how can you be of service to that individual? Like maybe this previous person you didn't really jive with, but any new shift, new transition, be aware of that and be open, come with a blank slate about like what can I learn from them and what can they learn from me. Obviously they were hired due to their specialty. I don't have that specialty. I would love to know more, but let me tell you what I can do for the organization. This is what I've been hired to do. And so I always say lead with the work. Lead with the work. It wasn't about me. It was just like, hey, do you need help? Like, this is what we do.
Mm-hmm.
Lead with the work. That's what I always say. So
Absolutely. That's great advice. And thank you for sharing that. I don't know if you said what you do in this role as a state director of health education.
oh, what I did? Oh
Mhm.
gosh, what didn't I do? I basically helped the offices. We had 6 offices really running from the Bay Area to Sacramento to San Diego, LA, Riverside, Orange County, a few just Fresno even, helping their staff staying in line with um, what is it called? Expectations of programs. Like, how are we going to standardize and make sure we're all on the same page across the state? So it is difficult when a lot of these offices are funded for very specific things from foundations or their local companies. So there was a lot of push pull about like, we need to let go of these projects, we need to sunset this, we need to that's actually the nature of nonprofits. Is due to their funding, they get probably a few contracts and then they have to figure out, well, what do we do with the staff member if the grant finishes? And so my role was coming in about how do we really maximize our um, non-restricted funding. They called it restricted funding and non-restricted funding. So restrictive meant the money's tied to deliverables, scope of work. We can't do anything else with it. Versus non-restrictive is we're just generating funds from our programs and, we have extra to recycle back and give back and do more with. So due to the opportunities at hand from their freedom from smoking programs to their asthma programs to their COPD programs, there was a lot going on that I had to figure out and help the staff kind of like, how do we continue to add value and raise our funds and recruit who we need to recruit and be a presence and not go crazy. Like how do we manage to all this? And so I was just part of more national work groups because it was a national organization. I was now a part of a lot of those conversations of how do we build capacity for these programs? How do we build stronger partnerships? How do we get more sponsorship for these programs? So I found myself working with the development team as much as I could on packaging our programs to be more value to, like, say, just different hospitals. I won't name anyone specific, but there were certain hospitals where we would really try to be clear to them, like, you know, if you come in at this sponsor level, you could do this, or if you come at this higher sponsor level, you can have access to these programs for your patients and this other kind of ultimate sort of deal that we would work through with them. So it was a lot of that internal weaving that I got to be a part of, and also working with the policy team and figuring out there was just like a lot of other teams. And so we also had to kind of find that coalescing and that collaboration to make sure that they're getting what they need and we're getting what we need on our program side.
There's
A lot of collaboration.
Yeah, that's a lot in that role, and I could only imagine the amount of learning and experiences that you've gotten and gained, and how you apply that to helping people in public health hard, as well as like helping you leverage to get those other roles that you're in currently. So kudos to you once again. And then the role after this, I have written here that it was contracted. Did you do this while you were doing that other role? Is this a role that you did afterwards?
No, so I quit that job. So that's another job I quit.
Okay,
I quit
tell me about that.
As much as I loved the promotion and I loved where we were going, it was sort of known that the national office was going to come and sort of overhaul the situation we were in, and that kind of did come to fruition. It took a while, but basically it had to do more with the vision that they were pushing on, and all the work that I had put in was going against what they wanted. Mm-hmm. And so it was more of like, I felt crazy in a way. As much as I loved the work, I hit a wall when I realized I can't now make a hard left. Like I was going here and you want me to now accept we're going to do it this other way. And I couldn't. I tried, but I'm like, I don't feel like I'm having natural conversations anymore. I was for a while, and now I feel like I'm a foreigner to these conversations. So I don't know. It was more of like, I don't think I can do this. It was just this realization, like, I don't think I can fight this fight, and I don't think I want to fight this fight. If this organization wants to go a certain way, it's going to go a certain way, and maybe I'm just in their way. And as much as the pay was good, as much as I was working from home in that situation as well. So I've been very blessed to have that flexibility in my career, is working from home. But I just knew that I'd gained enough skills, I gained enough experience that I felt like I can lend these skills to another company. I don't know who that will be. I will have to just survive. At the time, I also had bought a condo. So I had bought a condo and then I quit my job. Yes, I did. Yes, I did, Omari. Guilty. And I got a roommate right away. I was like, all right, who's paying half this rent? Who's paying half this mortgage?
Absolutely.
Cut your costs. I was like, all right, so I can live off top ramen. Check. I can live off half this, I can pay for half of this if I do Lyft. So I did Lyft for a while, just to try to like basically survive. And then I did other odd jobs. I was just kind of figuring it out. And then I landed this contract job, the one that you're referencing, which is with Kedren. Mm-hmm. And I think that was another Craigslist job. That's 3.
That's awesome.
That is the third and final. Well, maybe not final. Never say never, but the third one from Craigslist, and it was for tobacco cessation focused. And given my background with tobacco cessation and being a trainer for healthcare professionals on teaching people how to quit smoking, it was a very easy sort of interview for me to have, because I knew that world so well. So at the time, it kind of was a perfect fit. They were being funded by SAMHSA. What does SAMHSA stand for?
Substance, alcohols, I don't, something around like something related.
Substance abuse, health. Yeah.
Yeah.
So SAMHSA was the funder. Yeah. And it was for integrating behavioral health interventions in primary care. So their project was around behavioral health and quitting smoking. So I got to interview, and they have a very tough population, a lot of homeless population, folks who just got out of jail, incarceration, and a lot of my clients were just recently released from incarceration, and also having very difficult conversations there. Just helping these folks. I mean, these folks smoke packs a day, and here they are trying to, for me, like, what do I know? Like, I just, all I could do was inform them, these are your options, this is what's available, and just kind of dispel for them the stuff that they keep hearing. And I'm like, that's a myth, that's not true, like, let me tell you more. So that was a good part of it, is just helping them through the noise of it all. Like, your addiction isn't who you are. You are more than that kind of stuff. So, but that was very temporary. And yeah, and I still was applying to jobs because I knew it was going to be temporary. I was like, okay, I have a paycheck, but this thing ends in a year, and so what am I going to do? And I ended up applying to what my current job is. So I'm a senior consultant for community health at a healthcare organization, and that job I found on the company site. So I had my eye on this company, and I always encourage people, if there's a company you really admire and you really see yourself in, or you just wish you were, like, you're like, God, I wish I could work there. I'm like, you can, like. And so I try to share my story, and the fact that I kind of would keep my eye out for this company's job boards. And I ended up applying in June. I get a call back in August of that year, so 2 months later. And so happened to be, the recruiter tells me that I was part of the second round of interviews. They had already done the first round of interviews. And I was almost infuriated. I was like, what do you mean you've already done a round and you didn't call me? Like, what? So she was very honest. She's like, yeah, but they didn't offer anyone the position, and so they wanted to go back to the applicants, and your name came up. And but what happened was, she calls me at 10 a.m. And this is what recruiters do. They just make it seem like it's a very casual conversation. They're like, we just want to talk, just want to hear about, a little more about who you are and see if you'd be a good fit. Let me know when you can talk. Or is now a good time if they try to catch you? And I always say that is a trap. It is not a nice conversation. Sometimes they have, not like 100% of the time, but most of the time, that is your first interview. That is their job, is to push the next person through. And if you can't get through this person, then you're not going to move on to the next level. And so I told her, because I had been doing interviews and I knew the drill. I told her in the morning, can we talk in the afternoon? And so she scheduled me for like 3 or 4 p.m. that day. And I ended up studying all day. I studied the job the entire day. I wrote it out, I studied it, I highlighted things, I had questions, I highlighted what was important to me from my background in relation to the job. And to date, this is what now folks know my technique for interview is called total recall. And that's a technique I've coined the name more so because of what it does. That it helps you recall your experience, whether it's paid or unpaid, in totality against the job. So it's called total recall for that reason. And it's kind of something that I didn't realize I was doing. This is all I knew how to prepare, was like, study the job, study the job. And she asked me five of the hardest questions I've ever been asked in 30 minutes. And I'm so glad I studied, because if I had just taken that call in the morning and be like, yeah, let's talk, I would have not been ready. I would have not been ready. And she asked me harder questions than the second interview that was meeting with the supervisors. Like, the recruiter asked me the hardest questions. And so I like to share that, because I tell folks, take those calls very seriously. They are the interview. They are the interview. They're not there to chat. No one just wants to chat. No one's got time to chat. People, it's business. Like, are you the right person or not?
You're right. Someone's got to get paid somehow, right? So they gotta
exactly
through people. Okay.
Exactly, Omari.
That's awesome. Awesome. Thank you for sharing that. And yeah, if you're interested in knowing more about Zoila's day job, definitely reach out to her. She works for a West Coast large healthcare organization. You can probably figure it out.
Find me on LinkedIn.
Yeah, one way or another. But
you'll find me.
Yeah. So what type of things do you do in this role?
With my current job, I basically support just planning for community health initiatives in relation to our Southern California work. So I partner a lot with our medical centers from San Diego, Riverside, Orange County, LA, Bakersfield, just all over Southern California, and really making sure that they're getting the information they need to align, stay up to date. Some of the projects are very specific to working in work groups, helping with different regulatory cycles. So there's like 3-year projects we have. There's one that's coming up. And then just kind of making sure that we're moving in the direction with everything going on outside of Kaiser, especially with COVID. So I supported a lot of that COVID response and information gathering on what's happening on the ground, what's happening with our federally qualified health centers. What do we need to know to meet them with where they're at? Like, how else can we leverage our funds to really support these communities and build their capacity? So I really enjoy that aspect of my job.
Awesome. Well, yeah, thank you for sharing that. And
I thought you were just like very attentive. I was like, oh, he's like really.
I'm really digging what you're doing right now. Yeah, Zoom issues. Can't live without it.
I see you.
Yeah. So how long have you been in that role, and then when did you start your company, Public Health Hired?
So I've been in my current role at my company for 4 years as of this October. So it's been 4 quick years. It's like, whoa, can't believe it flew by. And then I started Public Health Hired LLC in January of this year. So it's not even been a full year. It's coming up. I guess I should do something, celebrate the anniversary of 1 full year. But yeah, I basically, I started it off really as just having conversations with people on Eventbrite. I don't know if you know Eventbrite, but it is a platform out there for folks to really connect, whether it's workshops or learning, languages, or getting help with their finances. There's just a lot of reasons to connect on there. So there's a lot of coaching that happens, and I offered just free Zoom meetings to people who want to talk about public health. So this was when I was recovering from COVID. I was sick. I was basically just alone and isolated with my son. And I ended up just using it more as a way to connect with folks about, hey, what's going on for you in your journey to get hired? Like, we can talk. I know some things. Basically, I'm like, I've been where you are. Like, let me know if you need any support. And so it started off just as free webinars, and then it rolled into Instagram, my Instagram following now, and folks over the year, like, luckily the word kept kind of growing. And one of my first clients, actually my first client, was a previous intern of mine. And she found me on Eventbrite. So she reminds me of just like that I'm on the right path when I started this company, because I was on Eventbrite just seeing like who needs help, and someone who knew me found me on there. And she's like, hey, do you offer any coaching? Because I've been looking for a job for a year now and I can't figure it out.
Mhm.
And because she knew me as a supervisor, she knew who I was, she knew my style, she trusted me. And she's like, what do you, give me a price. She's like, what are you willing to coach me and give me? And so she was the first one I had to like, I'm like, I don't know, like, you want to like do this with me for a month? And she's like, okay, let's do it. And so she also was the first person to get hired. So she was my first client and my first hire. And she's now working for a well-known nonprofit organization. And I'm so proud of her because she left government. She jumped from government to nonprofit, and she was doing a lot of heavy like government work. She's like, I can't do this anymore, get me out of this. And so she made a nice transition. She works from home now, she has 2 kids, and she has her master's, and she deserves it. So anyway, she's definitely, she keeps being my cheerleader because she reminds me that there's so many folks out there lost who don't have to be lost. You don't have like this space, public health, is so broad, is so dense, is so wide. But if you just first see all your options and then are honest with yourself about what do I want given those options, then it becomes a lot easier. I think a lot of us flounder in like, what is this? And so after quickly working with my clients, I just get them up to speed. These are options. This is what you're looking at. This is the reality. You're running into walls here. Stop doing that. Let's start doing this. And quickly they gain that traction that my first client did. Like, she's like, oh my God, it worked. She's like, I got through. She applied my methods in 3 months, and she's like, I got a job. And everyone around her was shocked because they're like, she actually dealt, and I also am so glad that she was my first success story because she dealt with imposter syndrome to the max. Like, she was like, I don't want to talk about myself. I don't feel comfortable talking about myself. And I'm like, what are you talking about? That's what interviews are for. Like, that's, you're not talking about yourself. You're talking
Yeah.
about the work. What do you mean? Like, so she dealt with very tough, like, just demons in her mind about like, they don't care about this, or like they're probably not listening, or I'm probably they probably think I'm exaggerating. And I'm like, you're not exaggerating. Like, these are facts. You're just speaking your truth when you interview, and getting to do it in a way that lands for these companies is what I help people do. Is you can have this conversation that you want to have with them. Let me show you what that means in their world before you get in the room. So anyways, I'll get off my soapbox, but
No,
yeah,
no,
but
that,
I love my first client. Yeah, shout out to her. She knows who she is. I won't say her name
yeah,
though.
as you should. That's awesome, and it's always good to have like that one success story. I think that's what they will tell you, like get that one result for that one person, and then from there things will go places. So
There's been many
congrats.
after her. Yes, there's been
Yeah,
many after
yeah,
her, but that's what you're right. If there's one, there's many.
yeah, and there are going to be many after this as well. So
I have a feeling.
continue doing that work. But I wanted to ask you, so how did you go from starting with Eventbrite and then actually starting an LLC? Or did you start the LLC when you were doing the Eventbrite? So what was that thought
No,
process?
so I wasn't. No, the LLC started once, basically like Instagram kind of, like once I started to actually get clients rolling in, because I would say in the spring is when I noticed this spring was really a big uptick of interest, and people kept coming with questions, and people kept coming, and a lot of them just didn't even know what I could do for them. Like, well, what can you do for me? And so I try to just tell them, like, I can do whatever, like look for jobs, do the resume, do the cover letter, do the interview prep, do the salary negotiation, talk to you about your options now, like whatever it is, because I'm comfortable sharing that. I've garnered enough information to share it back out with folks, happily. Like, I have no problem with that. And so it was more of like, I had to control the interest, and in order to control the interest, putting the LLC really made sense, because I do want to continue working in the field of public health. For me, in order to do what I do now with public health hired, I don't think I could do if I wasn't in the field. Right? Like, I need to be living and breathing public health to help you all get jobs. Like, it's kind of this thing I'm in right now. I don't know what the future holds. Like, if if there's companies out there that want to eventually pay me like millions of dollars to help y'all, hey, I'm all about it. But right now I'm just, obviously single mom doing what I can with what I have to offer. And this field has given me so much. It's given me, financial stability. It's giving me freedom. It's given me colleagues and friends and intellectuals that I would never have met otherwise. It's opened up doors I didn't know exist. I feel like my career is barely even starting. Like, I have yet to even tap into national work. Like, what if I want to work for, federal level? Like, there's so much you can do, or global, international. Like, keep going. Like, there's really no ends to this field. And so, if I can be part of just folks and their journey and helping them get to where they're trying to get to, like, sure, like, people need to go through their own journey. That's fine. I'm not against it. But I know personally that I could have really saved myself a lot of heartbreaks and difficult times and depression if I had someone who just told me, like, look, you can actually just do it this way and actually go after what you really want and not have to settle for things like on Craigslist.
Yeah, without Craigslist, you wouldn't be where you are right now. Shout out to Craigslist.
That's true.
So all part of the journey, so people can find you on Instagram at Public Health Hired. Where else can they find you?
Public Health Hired, my LinkedIn. I get a lot of folks coming to me from there as well. And then I have TikTok. I recently just started TikTok. So that's the other platform.
Okay, awesome. Well, I hope that you are more consistent on TikTok than I am. I have an account and there's videos from probably like a year ago that
I know it's hard. I know. Well, just so that folks understand, I have basically Public Health Hired is now officially like a community for folks to come learn about these jobs, because I'm very well known. My followers really keep following me for the job alerts that I drop. And those are just basically screenshots of jobs that I have vetted and screened as public health. I do this on my downtime. So a lot of times they drop at nighttime. But basically, because I know you're out there doing the job searches, it's hard to see public health jobs if you don't have that eye, if you don't know what you're looking for. And so every time someone sees my job alerts, they can feel sure that these are specifically for public health. You will not be seeing anything random on there but public health. And then I just have communities so people can connect. If people have questions of others, want to, make friends, network, that's also the other great opportunity on there.
On listening to Dr. Huntley's, well, partially listening to your episode on Dr. Huntley's podcast, which will be linked in the show notes for anyone that's interested in checking that out as well. You talked about a 2-page resume. And I wanted to ask why a 2-page resume over a 1-page resume, and maybe like any resume tips or like resume things, no-nos that you see a lot of the time, or like red flags that you see or something like that.
Oh yeah. So with resumes, the reason why it's 2-page resume is because those are the folks who I know get jobs. 2-page resume has worked for me. 1 page has never worked for me. And a 2-page actually gives you just enough space to really address the job and have anywhere from 4 to 7 past experiences. So a healthy working professional who has, whether it's paid or unpaid, it doesn't matter, you need to have 4 to 7 experiences spelled out on those 2 pages. And you just can't do that on a 1 page. And also the biggest blunder, the biggest mistake I find on resumes is folks do not put a summary. A summary is the hardest thing, I will say, even for me, because it actually you develop a summary after you've updated your bullets of your resume. So when you read a job, you need to make sure you tailor your resume against that job with the bullets, but you also need to then summarize who you are against that job. And so I teach people how to do that. And for folks who have none at all, I can provide you one during even a mentor session with me. So that's been something very popular folks come to me for. It's like, I know I need one, but I don't even know how to do it. What do I do? So the summary is lacking heavily on these. And you need to have one because you need to have, why? Because you need to have insurance against a burnt out manager or a lazy manager. Depending on how many resumes these folks get, they want to just get to the point. They're like, who are you? What do you have to offer? And when you have a summary that gets to the point and reiterates what they should find in your summary, that really makes sense to a hiring manager. And everyone who applies this gains that kind of traction. They're like, oh, I got a call back. I'm like, yeah, because you got to the point.
Mhm.
They see that you get it. They see that you understand what they're looking for.
Okay, I like that a lot. And yeah, I definitely agree. 2-page resume over one, unless you're like an undergrad or something like that. And then even then you might be able to get a 2-page.
Try a 1.5. 1.5 is better than just a 1-pager. I'm just saying, it speaks more.
Absolutely, absolutely. Because 1 page is not a lot to fit information on.
Mm-hmm. Mm-hmm.
And then what services do you offer? You said that there's a mentorship call. What other services do you offer?
Yeah, so I offer now, you can just do a one-time visit with me over Zoom, which are known as mentor sessions. And so folks tend to just want some grounding and guidance on like, what am I doing? What are my options? Reviewing their resume. But I've also updated folks' resumes on the fly over Zoom, and they get to see how I do that for them. And they kind of take it from there.
Mhm.
Or we can even do interview prep sessions where you apply my total recall technique and I show you how to really prepare for an interview. Yes, papas. Are you scared? He keeps getting scared. But I can basically help you with whether it's finding jobs or doing your resume. You want something else, or doing your resume, or doing interview prep. So it's kind of a gamut for the mentor sessions. Okay, papas. In regards to the mentorship service, so I basically offer it's like the ultimate package where you have me retained as your coach and your mentor until you get hired. So there's no end date. You basically have me as your support regardless of what stage you're at. So whether you've been doing this for a while or you're just getting started in your job hunt, I can help you get grounded, consider your options, see yourself, your background in a different light, and really help you see a different kind of trajectory that maybe you don't see for yourself, or kind of add to what you see for yourself. Like, what do you want to do? Let me support that. So everyone comes to me for different reasons. In fact, the couple folks that I have right now actually came to me because they just want to kind of feel it out for a while. They're like, I don't know, like I have a job right now and I know I want to make a transition, but I don't know what that transition will be. And so I'm lucky that these folks can trust me, and just having these very vulnerable conversations about like, what do I want to do with my life? What do I want to do with my life's work? And so that's the beauty of this mentorship, is we can just kind of spend time talking about where you're at, or we can go full throttle and just be like, let's apply to a bunch of stuff. Like, let's go. And we keep applying and helping you with your interviews until you get hired. So that's the mentorship.
Okay, that's awesome, and that's a
very tailored.
Yeah, crazy good tailored service, and I could only imagine how many success stories that you have, because I know that you post those testimonials on Instagram all the time, and I love that. So keep it coming and keep helping out people, because I think a lot of people in public health.
To date, we have 21 job offers in the year of 2021. Oh, 21 job offers 2021. Wow, I didn't even think about that.
That is great.
Yeah, great milestone.
Yeah. Shout out to you and all the hard work that you're doing, as well as all the people that took the time and the effort and the money to say, this is what I want to really build out my career and like think about my future and take those steps to get to where they need to be, to get to where they need to be or want to be in the future. Yes. So shout out to you for doing that.
Happy to be a part of the journey.
Yeah. So before I move you on to the Furious five questions I ask all guests, I would like to ask you, where would you like to see yourself in the future?
Oh man, I haven't thought about that in a while, just because I've been so like in the moment and in helping with folks where they're at, and even my own household fires here. But no, I think in 5 years, definitely see myself still living here and stable here. Like, I don't want to move. I think I mentioned earlier, I moved every single year in my adult life, and I just want to stay put for a while. That also means staying put with my organization and really growing within the company if possible. I always say there's always opportunity. You never really know. every meeting, is another opportunity, to be honest. Like, you just don't know who's listening and who's a part of that conversation. So whether it's growing within my organization or growing within another healthcare organization, I think at the end of the day, I just want to make sure that my skills in planning and implementation and really supporting more of that engagement, community engagement. In fact, that's one of the reasons that I was hired for, is I've gained enough community engagement skills to help our team on the ground who's trying to work with difficult partners or have difficult conversations. So that's actually been a benefit to me. Like, I can tell you I've been in enough difficult conversations to they kind of go a certain way. So I enjoy that, like, and I welcome that. I think I've even considered going back to school for communications. That's something that's been on my mind lately. I used to think like I wouldn't want to go back to school, but given the time that we're in and hearing all this misinformation and me now like feeling like, wow, I have so much to share. I didn't even realize I had so much to share. Like, maybe I should get really good at this. Maybe I should find, like, so anyways, I'm just asking myself different kinds of questions these days of not that I would be leaving public health, but could it be of more value if I get another degree or add to my education for, say, communications or something. So we'll see.
Yeah, and I like that. I like that it's open and there are different avenues that you can do. But I look forward to seeing you continue to grow in your role as well as.
Stay tuned. Maybe another Craigslist job.
I highly doubt that. But it is possible. You never know. So moving on to the Furious Five, the 5 questions I ask all guests. Number 1, what advice would you give to a student trying to pursue a career in public health?
Number 1 advice given to a student starting their career in public health, I would say, I think I kind of tried to hint at this, which is expose yourself to as many opportunities as you can and be available to different populations, different groups. Yes, some work is challenging, but you don't grow unless there's some challenge. Like, I don't want it to feel like impossible for you, but I want it to feel like you're hungry for it. You want to know more and you're willing to do the work to learn more. So just throw yourself in as many different places, whether it's volunteering, internship, or temporary work. There's remote work. There's a lot of remote work out there. Contact tracing is still big. So throw yourself in as many environments as you can in your career.
Awesome. Number 2, if you're talking to someone wanting to get into your position, what advice would you give them?
Someone who's trying to get into my position?
Yeah.
Oh my gosh. I would say if you're trying to be a senior consultant at a healthcare company, you need to be confident in what you specialize in and be sure that you can own that space they're asking of you. So what I mean by that is my role spelled out, they wanted someone familiar with various stakeholder groups and working with community. And so I had to really walk them backwards on what that meant, like how many communities, where, rural, urban, working with homeless, working with drug addiction, working with Spanish-speaking families. Like, that's part of the work that I teach people to do in their interviews, is like, give them those details. Don't just say like, yeah, I've worked with underserved communities.
How?
No, what? Like what? Who, where, when, how? Like, what was it? Yeah. So open up those details, and that's how you get these higher roles, is that you know yourself that well. Like, you can walk them through that experience. So yeah, that would be my tip.
Awesome. Number 3, what's something you're working on improving in your life right now?
Improving on my life right now, besides just trying to get a grip on single motherhood. I don't know if I have time to think about anything else. I mean, I've been very blessed to, again, be employed by an organization that has allowed us to work from home. I don't know how much longer this is going to continue. I keep hearing that they may be changing our work environment so that we occasionally go in or have an option to meet in person. but it doesn't seem like it'll be mandated anytime soon. So it's really given me the flexibility to be able to be here for my son. He does go to daycare for part of the day, but it's nothing like, if I had to go to an office, or if I was required to, be a waitress or something that required me to be at a location. So this work has definitely allowed me to focus on just improving on, like, how do I make sure that we have what we need, like, as we continue through this pandemic, and hopefully things continue to get better. But personally, what I'm improving on is just keep me and my son priority, like TNI. So let's not lose sight of that. So
awesome. Number 4, professionally, do you recommend anything besides Public Health Hired?
Oh, like other resources?
Yeah, resources, tools, websites, podcasts.
Yeah, there's a few. Obviously Dr. Huntley, I was just on her podcast. I also follow a few folks who really help with getting you in school. So not only do I follow like career center stuff, but there's like the international PhD student that I follow. I recommend her to folks who are looking for help on applying to doctorate programs. Dr. Huntley, if you're interested in epidemiology. I also follow just general career coaches. So like Marie Forleo, I really follow. I've followed her forever though. Ashley Stahl, she's another really big career coach. And I think I like to tap into them more so for the overall motivation that just anyone needs, and any career coach would need. But for folks who need more of that, those are two really great sources as well.
Awesome. And I'll be sure to find them or ask you for them and link them in the show notes for everyone to check out. And then last but not least, where can people connect with you?
Where can people connect with me?
Yes.
So easiest place to find me is on Instagram at Public Health Hired. And I check the DMs in the evenings. So just send me your questions or comments, and I read through all of them. And then I also post my stories. I post job alerts. So that's definitely a reason to follow on Instagram. If you don't want to work with me, that's fine. I will not take offense to that. I know I'm not everyone's cup of tea, and that is okay. I have a certain style and sense of being. But if you just want to get more like job information, then that's a really good reason to follow at Instagram at Public Health Hired.
Okay, awesome. And I'll definitely be sure to connect with Zoila, everyone. She is sharing great information. And for you all that need a little extra help with mentorship and coaching, reach out to her. She's definitely a great resource. And shout out to you for being a super mom and like just watching you do some things. And I know like a lot of this probably gonna get edited out, but there's definitely gonna be some parts. Yeah, please take a photo.
No, you're right. Yeah, you're gonna have to edit the part where my kid had an accident. Absolutely, yeah. But it is. I'm not lying when I say I was ready to be a single mom, but not a single mom in a pandemic. I'm like, oh my God, like this is too much.
Yeah, but you're doing an amazing job, and I just want to say shout out to you for that, because it is amazing to have you like conversing with me while also like changing the channel or doing whatever you're doing on the TV and all of that great stuff. So shout out to you, and thank you so much for coming on and sharing your story and sharing all the insights.
Thank you for your time. This was great. Honestly, you're doing such great work, and I'll continue to be a fan and following and sending people your way.
Awesome.
Thank you.
Thank
you. Really appreciate it.
My pleasure, and I'll be sure to send people your way as well.
Thank you.
Housekeeping items, everyone. Be sure to subscribe, be sure to review, be sure to leave a like if you're on YouTube, share with a friend. And if you'd like to support, you can go to buymeacoffee.com/the PH Millennial. There are also other ways to support in the show notes, and I created a support page on my website, so you can check that out as well. But see you all next week. Peace.